Sir.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, with the devolution, we've seen a lot of challenges. My approach, again, would be a consultative approach involving the counties, involving the National Technical Working Group, the DG, the PS, and all the stakeholders involved, including partners. And in this case, we need to have these consultations in routine basis to discuss the HR capacity. Additionally, we need to come with strategies, action plans, including regulations, to ensure that all the counties have the appropriate specialists. And we can monitor the presence and the activities of the specialists using a digital platform, of which I strongly advocate for. I can also say that I am a member of the Eastern Central Southern African College of Physicians. And in this program, I was the initial group of trainers that was trained in Entebbe, and this program was rolled out in Kenya. And we are almost having the first lot graduating, and they're 41 in number. Additionally, there are other specialist training going on for gynecology and obstetrical surgery. And these are areas that we can engage with the programs and see how to support the various counties so that they can have specialists trained within the facility.
Vicaria.
Thank you, Chair. Sorry. Daktari Deborah, na mambo mengine kukaja na policy ya kuweka the CHVs, the Community Health Volunteers, ambaye wao watashughulika sana na kujaribu kuzuia kabla pengine, na unajua hawalipwi kwa wakati unaofaa, na zile hela pia wanazopatiwa ni hela kidogo sana. Pengine njia gani utatumika kuona kama wataweza kupata hela zao kwa wakati unaofaa na pengine kuongeza juu kidogo, ndio waweze kusaidia kwa kuzuia kabla haijafika ile ya kutumia hela nyingi ya kwenda Pili, watu wengi wanapata ajali, emergency na mambo mengine, magonjwa ambayo pengine ama kama ni accident za barabara. Wanapoenda katika mahospitali yetu, nisiseme ya counties kwa sababu pengine kwa sababu hiyo iko devolved, lakini katika hospitali za serikali wanakatazwa kuwa admitted ama kuchukuliwa katika ile emergency ya dharura ya haraka kwa sababu hawana pesa za kulipa deposit na mambo mengine. Pengine ni njia gani utachukua kuweza kufanya hali hii isiwe ni kitu cha kurudiwa vile tunavyoona kila wakati? Asante.
Answer.
Through you, Honorable Chair, and by the Honorable Member, indeed the community health program is critical community, and community health workers are a strong, so we need to embrace them and support them. Working in Fikiri region of Nairobi, it covered Shauri Moyo, Huruma, Madare, Kariobangi, part of Korogosho up to Kayole. We were strengthen the community health program. And what we did is ensure that they were bringing mothers for antenatal care, bringing children for immunization, distributing disinfectants, providing preventive promotion care and rehabilitation, because they were part of the community. And the work was marvelous, and I'm happy that the country is embracing the community health program. And so we need to support them, and again, a consultative effort involving the multiple stakeholders, so that as a team we can come up with action plans to have the fruitful implementation of community health programs and universal health coverage in general. For the emergencies, again, even as we transition, we need to ensure that they are covered, and we need, even in the UHC program, part of what is covered is emergency conditions. And so I believe that by incorporating this, all Kenyans will be able to access care even in emergent situations.
Honorable Robert Mbui.
Yeah, thank you, Mr. Speaker. Nominee, corruption cases have been a major problem in the health sector. Some time back, there were those clinics that were bought, containers that were being charged at about 10 million a piece, which was highly exorbitant. And recently also we've seen when we had COVID, there were scandals at KEMSA, and there was even a recent scandal under this regime which led to the dismissal of the PS then of health. What will you do to minimize, or if possible, completely eradicate this in that health sector?
Through you, Chair, I would like to address the issue of corruption by honorable member. Again, a consent to conduct a situational analysis and see where the gaps are. But from my opinion, I think that we need to strengthen the processes and procedures that exist. And one of the ways is through a digital platform. That way, we reduce the human-to-human interface from batch 001 gets from the national up to the patient's hand. Yeah, and so we'll be able to ensure that there is a seamless flow. So I am an advocate for the digital platform. Equally, we can involve external bodies to monitor also the challenges that are involved therein, and we can have routine meetings and feedback. Additionally, we need to have accountability and visibility frameworks, and also work together with the various commissions to address the issue of corruption.
Thank you very much, Mr. Speaker. Mr. Speaker, I've listened to the nominees so far, Deborah. My name is Owen Bayer. I'm not the honorable member. I hear you talk about situational analysis. I hear you talk, I've counted them, there are 10 now. Digital platform, there are 8 consultations, there are around 7 there. You keep on using the same ones all the time. But the health sector is a big thing, big, very big. And I think it carries one of the biggest budgets in this country. And it has been a Tower of Babel, okay? There are a lot of conflicting people striking, court cases, a lot of issues. It requires a very high level of leadership. And that high level of leadership is policy. But as I listen to you, I'm not hearing you enunciate or really bring out policy issues apart from consultation. I think the health sector suffers from real strong policies that can drive the sector, so that we have all these issues, these strikes and everything else really not in place. There's been the question that has been asked on, will you support a health service commission, which everybody else has been talking about. Probably that's the panacea for the